It is the last week of school for most folks in East Texas, and that means the seniors of 2012 are starting to look ahead to future careers. New this morning, our Lauren Callahan has had her own mini career day this week, visiting people who work in different professions, and she introduced us to a police officer and a firefighter last hour. She joins us live in the studio with part 2 of her results this morning. Lauren, who else are you learning what the career looks like this morning?
Well, Taylor, I had a lot of fun with this. I went to visit professionals we hear about every day, people who use their jobs to serve all of us in some capacity. And earlier this week, I was able to visit with a lawyer, a doctor, and a dentist who are all doing just that right here in East Texas.
I decided to become a lawyer because I wanted to help people, and I knew that I wanted to speak and have somewhat of a competitive type environment, which you do in the context of a lawsuit.
Spitzer says good grades are a necessity because you'll have to compete with other students to get into law school. It also takes some time. Getting your Juris Doctorate degree takes 3 years after your bachelor's degree, but Spitzer says helping people is worth it.
It really gives you a feeling of satisfaction to take a person who's facing some challenge in the legal system to get them through that in a way that that gets them further down the road and allows them to continue on with their life.
Becoming a doctor also requires a lot of school, a bachelor's degree, 4 years of medical school, and at least 3 years of residency.
Despite what you may think, the best doctors aren't always the gunner students. They're people who have a lot of depth to them, because medicine requires you to use a lot of things. You do have to have a good brain, you have to be able to learn things and use it, but you also have to have good people and communication skills.
Tyler dentist Lloyd Dowd was conducting cancer research at MD Anderson Cancer Center when he was drawn into dentistry for a special reason.
It combines the surgery with artistry. You can't be a dentist and not be an artist, because you're not just doing surgery. When you're doing restorative dentistry, you're doing basically you're sculpting someone's smile. And I like both of those.
Both Dowd and Reitmeyer encourage future doctors and dentists to strongly consider how the business aspect of their respective jobs may affect the medicine they practice.
Even more now, medicine's a business. Healthcare has a lot to do with managing people, marketing, running your practice. So having business skills is essential too.
Talk to them about what really dental practice is like from the clinical aspect as well as the business aspect. Because if you don't run it like a business, you won't stay in business. You have to blend the two together.
But they both encourage students to stick with it.
It takes a long time. It takes a lot of dedication. In the old days, a lot of people went into medicine for money reasons, but that's going to be changing in the next few years because of cutbacks in healthcare. But if you care about people, if you're bright, if you really want to make a difference in somebody's life, this is a great way to do it.
The one thing every professional I saw this week recommended was to take some time to shadow someone who has the job you want to have. It gives you a great idea of what the day in, day out of that job is really like. Also, each one of them said they got into their jobs because they felt they were called to do it. They were excited about it, and because more or less they'd be able to help people. And as you can see, Taylor, there are a lot of ways to be able to do just that. Back to you.
Okay, well, Lauren, I've got to ask you, because we asked Brett during part 1 in the first hour. You know, a lot of people may not know this. Lauren is our most educated member of Good Morning East Texas. She's got the most postgraduate degrees and that kind of thing. Lauren, what did you want to be when you graduated high school around this time a few years back?
Believe it or not, well, by the time I graduated from high school, I was pretty much on a communications track.
Okay.
But back when I was a kid, for a long time, I really wanted to be a pediatrician, and I loved biology. We've been talking this morning about some dissection time that we had in biology class. I was not so good at chemistry and not so good at physics, and those things kind of steered me on to the writing career.
All right, well, we're glad to have you as a journalist. We'll put it that way. Lauren Callahan with that live report this morning.